Our topic for today is MS-specific physical therapy. I hope that too many of you guys haven't experienced this personally, but I have a feeling the majority of you have, where you've been to physical therapy before, or maybe it was a personal trainer or just a gym, and you either didn't notice any benefit or you felt like you were getting stronger or better balance, but your day-to-day functions weren't any easier. And a big reason for that is because what you were doing wasn't specific to MS. So if you are new here, one thing that I like to do is see who is on. So I'm going to open the chat area and let me know where you're tuning in from. You can say hello. Kevin's asking if we have to work a lot on overcoming spasticity related stretching, does that help with BDNF? So from the research that I have seen, BDNF is not necessarily released from stretching. It's more movement-based exercise. So it might be cardio or balance or strengthening, but I don't believe it's released with stretching. It's more movement-based. Great question. Okay, so I'm curious. I won't be able to see right away, but I want you guys to type in the chat if you've done any of these exercises. And I love all of these exercises I'm about to show you, but some of them are MS specific and others are not. So let me back up here. All right. Okay. So and by the way, I'm going to do these on my floor because I don't have a plinth table right here, but you may have done these in the physical therapy clinic on a plinth table or at home on a bed or on a couch, not the floor necessarily. But so these are some of my favorite orthopedic traditional physical therapy exercises. So this one is called the straight leg raise. So it looks something like this, generally speaking. Have you done the straight leg raise? If so, type SLR, straight leg raise. So this is a great orthopedic exercise to strengthen your hip flexors. However, actually, before I go there, I'll show you some of the other ones. So this is a straight leg raise, and of course, you do it on both sides. Okay, so it's a straight leg raise. Another one is the sideline leg raise. So this one looks like this. So if you've done this one before, type side in the chat and I'll look when I get closer to my computer. So this is a great orthopedic exercise to strengthen your glutes and the abductors, the outside of your legs. So theoretically, if this carried over to a standing position, this could help with things like knee kissing and keeping your leg out when you're walking versus a scissor gait. So that's another one of my favorites. Oh, clamshell. One of my all-time faves. So clamshell looks like this. And I don't have much hip rotation, as I'm sure you can see. If you were to do this exercise, you might be able to open up wider, but if I keep my hips where I'm supposed to, this is as far as I can reach. So this is another great exercise for the hip abductors, the glutes, the rotators. So if you've done this, type clam or clamshell. Let's see, another one is bridging. So bridging is this. Another glute one. Glutes are on my mind today, apparently. So if you've done this one, type bridging. So that's a good one as well. Sometimes you'll have a band around your knees and maybe you'll push out like this, or a ball in between your knees and you'll squeeze the ball as you lift up. Another one, the last orthopedic one I'll demonstrate, is actually a standing one. So almost every client that I have, when they've gone to traditional PT, they've done this one where they stand with their feet together or as close as they can, and then they close their eyes. And you might even have to do this. That's a specific test. Have you done that one? So if yes, type like balance with eyes closed or something, or just balance. So that's another common one. Now, before I come up and see which ones you guys have and haven't done, it's so important to understand why those ones are not MS specific ones. So The way that our brain and spinal cord work is that when you have MS, is that you don't have the same carryover as someone without MS. So what I mean by that is I do not have MS. Therefore, if I do a lot of straight leg raises, again, this exercise is to strengthen my hip flexors right here. So your hip flexors, in addition to doing this, I also use my hip flexors when I'm sitting and doing this. So theoretically, if I got really great at straight leg raise without even practicing this, I would be able to march better. Similarly, standing up, this also uses my hip flexors. So because I don't have MS, if I was able to do amazing straight leg raises without even practicing much or at all, my standing marching would also be better. Now, standing marching is also one of the movements that you need to take a step forward. So my walking would improve simply because I did straight leg raises. But when you have MS, you don't have that same carryover. So you might get full strength with your straight leg raises, but then you go to sit up or stand and use your hip flexors because you just strengthened your hip flexors a ton, but you go to use your hip flexors sitting or standing and they don't work because you don't have that carryover. So that's why MS specific exercises are so helpful, because honestly, understanding why something is or isn't MS specific is a game changer. Because if you guys are working with physical therapists in person and they are having you do side lying, leg raise, bridging, they're not bad, but they're just not the best for you. You're not going to get the biggest bang for your buck with those ones. So we're taking the goal of walking and we're going to break it down. So, all right, I'm going to take a step forward. I want you guys watching this leg. So in order for me to take a step forward, these are the movements that need to occur. So number one, I need to be able to shift my body weight onto this front leg. Number two, I need to be able to bend my knee. Number three is swoop my toes up. Number four, bring my knee up. 5, straighten my knee. 6, heel down. And that entire time that I was moving my leg forward like this, I was standing on one leg. So single leg stance. I'll review that again. But number one, shift your weight forward. Number two, bend your knee. Swoop your toes, knee up, straighten, heel down, single leg stance. So those are the movements, and to be honest, all but one of those, or all but two, are more strengthening based. That doesn't even include the flexibility that we need to move forward. But when we're talking about functional strengthening exercises, those are 7 movements that you now can turn into an exercise. So instead of just practicing walking forward, which is also helpful, but instead of just practicing that, pick any of those 7. Let's for right now, let's go with weight shifting. The first one was weight shifting. So what I mean when I say turn that into an exercise is to literally do that movement as an exercise. So weight shifting was the first part. That was this. So one of my exercises is going to be this. I'm going to shift as much weight forward as I can and back safely. How much weight can I put on this front leg without my knee snapping back, without my knee buckling, without losing my balance? And I'm just going to go forward and back with a little bit of pauses each direction. And of course, I'll do the other side. Shift and back. So that was one of them. Another one of those 7 was marching, was bringing my knee up. So if you remember forward, we did this, and then we did this. So that marching movement is another exercise I could do. So you can stand up hold on to a rollator, trekking poles, whatever you got, or nothing, and march. Now, obviously this requires balance too, which is why I like to hold on to something so you don't have to worry about the balance. If that's too challenging, do marching in a different position. Marching, when sitting down, looks like this. You can do marching reclined. So there's lots of different positions that you can do that in, but that's what you do. You pick your goal, in this case, walking. You break it down into as many steps as you can think of. And if you can't think of any, talk to your physical therapist, ask them. And then all those steps are now your own exercises. So maybe it depends how long they take you. Maybe you focus on all 7. If all 7 of those things are challenging for you, in some way, shape, or form, they should be included into your home exercise program. Now, if some are really challenging, maybe you just include 3 to 4 right now. When those get stronger, then you can add some of the other ones in, so you progress to those ones. But that's what functional exercise means. That's what I call MS specific exercise is, what is your goal? Break it down. Those are now your exercises. From there, we just find what position you can do it in successfully. Melissa says, what if you have no movement when doing the exercise? Yeah. So if you have no movement, I'm glad you asked this because I briefly touched on it earlier, but not with this wording. If you have no movement at all, you still practice the exercise in the easiest position that's possible for you. So if marching, you can march standing, seated, lying on your side, lying on your back. Those are the most common ones. Lying on your back with your legs up. Find whichever position, even if there's no movement in all of them. Is there any one of those positions that feels like it requires slightly less effort from you? If so, pick that position and practice marching in that position as often as you can. Every repetition that you practice, your brain is trying to find a neural pathway down to your hip flexors, if we're talking about marching. So regardless of if you have movement or not, and I know this is easier said than done, but that's truly what it takes to find a brand new neural pathway. It takes consistent effort over and over and over again, even if you see no movement. Oh, good question. How much aerobic exercise is needed? To my knowledge, we don't know yet. I'm going to an annual MS conference this May. I am so excited. It's at the end of May. It's May 31st. I'm really hoping to find some new research on aerobic exercise at that conference. As of right now, we don't know. There's no research, to my knowledge, saying how long it should be or what intensity it should be. We just know that if you do it first, before your functional exercise, it's helpful. So do what you can. I usually tell my clients to do between like 3 and 5 minutes of aerobic work. Oh, good. Another good question. How soon after aerobic exercise should you do functional exercise? Again, there's no guidelines for this, so I'm just stating what my opinion is. I would say for sure within 20 minutes. Keep in mind too, we don't know how intense cardio needs to be. If you are pushing yourself so hard during your cardio or your aerobic exercise that you can't exercise for 2 hours, you're pushing too hard. Or if you don't have enough time, just do something quick to increase your heart rate. Maybe it's just punching like this as fast as you can with as much effort, and you're talking out loud at the same time. My heart's literally already racing right now. So just find something that you can get your heart rate going quick. Do that for a minute and then do your exercise. But if you're doing a full set of cardio-based movements and then you're functional, I would say try to shoot for 20 minutes or sooner. Does any and all dance effective? So the research specifically looked at ballroom dancing and ballet. So those are the ones found to be effective. With that said, there might be other forms of dance that are equally as helpful. They just weren't researched, which is my guess. Would this be the same for stroke? I have MS and a stroke in 2018. Stroke therapy is a little bit different. However, it's my opinion that MS-specific exercises can be great also for stroke, for Parkinson's. Again, Parkinson's is a little bit different too. Fibromyalgia, I have a few clients with hemispastic paraplegia, and they found great benefit from the missing link or MS specific exercises. What's another one? It's right on the tip of my tongue. Oh my gosh, I can't think of it. But there's other diagnoses that functional exercise can still help with. And I think stroke would be in that group. Is an elliptical good for cardio to start? Yeah, elliptical can be good for cardio, and elliptical is good for walking as well. I just feel like when you have MS, you either should be doing a mix of functional exercise and then traditional exercise, or if you had to pick, just functional. If you have goals of improving your function, most, if not all, I'm going to say all people who work with physical therapists usually, and all of my clients, I can say for sure, have a function that they're trying to improve, which is why I focus mostly on that. But that's my belief. Either do a mix of both, or if you're short on time or you just want to focus on one, I personally would just focus on the function if you have goals of improving your function. Awesome. All right. Thank you so much. I will see you then. Have a great rest of your month. Bye, everyone.